Hi guys, welcome back to my channel Navjot Talks. This is Navjot, and in this video we are going to talk about NCLEX a little bit in a way that if you are in your home country and you're thinking to apply for Canada NCLEX and you want to move here permanently and you have a decision in your mind that it's your plan to move to Canada and you want to be a registered nurse in Canada, so you're confused if you should start preparing for NCLEX now or you should wait to get eligibility for NCLEX. So if you are planning to move to Canada and you have decided and it's clear in your mind that this is your step which you're going to take and you're determined that this is something which I'm going to go for, you should start preparing for your NCLEX right away, because the books which you have now in your degree, everything is line to line in detail. That is the best way to study for NCLEX, because now everything, whatever your teachers are telling you, have good professors, good teachers, good lecturers who can help you in if a concept is not clear. You can go and talk with them. You can start making some notes now, all important medications or all important diseases, because once you're out of the university, I know nobody goes and touch those books again to read line to line, because there's so many books, pharmacology and medical surgical and psychology, all kind of books. You cannot spend time on them to read them again. So now is the best time to start making some notes if you have decided to move to Canada permanently. So you shouldn't be waiting to hear for the eligibility, because automatically you will get the eligibility. Now it's very easy to become a registered nurse in Canada. Even if you cannot get the eligibility in Canada, you can go for Australia board or for America, and then they will give you the eligibility. Once you pass that exam, you're gonna send the result to CNO. CNO will determine if all the other eligibility requirements are met already, like evidence of practice or English proficiency. Once it's done, you can start practicing after getting a license. You will soon get the license. So so if you are in India and if you are thinking to move to Canada, the moment you make your mind fix that I have to move to Canada, this is something which is fixed in, this is my goal and there is no change which I'm thinking to make to that, so that is the time when you should start applying for NNAS and you should start for applying for America. Because to apply for America, I don't think so you have to be in Canada, because America exam can be given in Canada too. So it's very good if you pass your degree and you got all the transcripts and everything, but your visa is still under process for Canada. So start applying for that kind of thing, like I'm a NYSCD board, and then prepare for your transcript, talk to your teachers. And one more thing, once you leave your country, it's difficult to sometimes contact the teachers. So when you're in India, you should start doing all that stuff. And for preparation, I would say all the books which you have now, because you still have to study them to pass your board exams of nursing school. So this is a time when you should start making some notes. So buy some nice notebooks, and medical surgical on a different copy, like different notebook, mental health on a different notebook, all the important points, so that you can carry all those books or notebooks with you, because you cannot bring your medical surgical, it's a heavy book, right? You cannot bring all those books here, but your notebooks you can still bring them here. So then when you are actually preparing for the NCLEX, once you get the eligibility, you just have to read Saunders, or if there is no like a concept which is not clear, you can just refer back to your notes, because Saunders, it doesn't give you detailed information about any topic, because it assumes that you know that stuff already. It's just like the important key points which it gives you, but still it's a big book. So can you imagine if you want in detail information about all the topic which is in Saunders, you actually have to go and read all 4 years of thing again. So start making some good notes there, because honestly I got a lot of help what I studied in my 4 years of degree, because my professors were really good, and I still remember the topics which I was taught in the university. It really helped me during my NCLEX exam, because some of the concepts which were very clear to me during the degree, when I was using Saunders, I was like, oh yeah, my teacher told me this thing, so Saunders doesn't say the reason for that, and then I know the reason because my teacher told me this thing, or I saw it somewhere in the Brunner's book I saw somewhere, in the Siddharth's book. So this is something which I can say that your nursing school books can be of great help if you read them nicely and correctly. They will not only help you to have good marks in the nursing school, but they will also help you to pass your NCLEX exam. And one more thing I wanted to tell you, that was, don't spend a lot of money on buying so many books, because once you have so much of the material, you can't really focus on what is very important, because there are so many questions in one book, so many questions in the other book. But once your concept is clear, you can just pick some random questions, like 10 on one topic from one book and 10 on the same topic from another book. In that way you can just calculate where you are standing. Like if you're passing 5 questions out of 10, and then you are passing 5 in that another book from 10, and then you know it, okay, the same level. But if you think that you can do all the books, it's just a wastage of time, because they're gonna twist same kind of questions and same kind of topics. But just to test yourself, you can do some random questions from so many books. But I would say just stick to one book, which is, in my case, I was like using Saunders, and it was of great help. And that's the only book which is for the Canadian version of NCLEX. But there's so many books, like Mosby and Kaplan, but I know the people from America, they're using them. But for Canada, I just knew one book which is like Canadian version, so I just used that book. And I was like, okay, if somebody designed a book for NCLEX, it should be carrying all the information which I need in order to pass my NCLEX. So I was never double-minded to go for different books, so I just was using Saunders. So this is a suggestion which I just want to give you. Even if you're in your home country, if it's final that you're coming to Canada, maybe you can buy e-book of Saunders and then start reading that book. Once you do one topic like medical surgical, once you do one topic like respiratory system, you do 10 diseases, and then now is the time to go to Saunders and see what they are saying, and you will see, oh yeah, this is so easy, this was something which I just read in my book yesterday. So this is how it is. Okay, so now is the time to say goodbye. I'm gonna see you in another video very soon. And those who have been posting comments, I have seen a lot of people, they are posting comments, Mr. so and so is good person to refer for NCLEX. Those are the advertisers. Please don't go for them. They're leaving their numbers on my comments. But I would say don't. Nobody who is claiming that this person should help you, this person, that's the same person with so many different accounts, just trying to promote it. Like one person is saying, oh, did you I wish I could pass my NCLEX, and another person is coming and saying, oh, I want you to refer to this person, he's really good. And the third person is saying, oh yeah, I heard him. Those are the same people. They're just putting comments because they know that somebody has posted a video which says that I passed my R, and now that's the target position, so we should go there and go for those numbers. But that's a trap, and I told you in my video, don't fall into the traps, because once they figure out that you are the candidate for NCLEX, they will start catching you, so that you fall into a trap. And if you don't pass your NCLEX, don't lose the hopes, because it's just an exam. It's not the end of the world, it's not the end of the life. But I hope you all pass your exam, and I hope you all become registered nurses, very good nurses. And I'll see you next video. Till then, take care. Bye.